Hi, I'm Nancy O'Neill, and you're watching Aging Gracefully on Suncoast FYI. This episode will feature Dr. Sessa from Sarasota Surgical Arts, Dr. Sampson from the Sarasota Vascular Specialists, and Andrew Ford from Sarasota Estate Auctions. Thanks for tuning in. Dr. Sessa is in the studio today to clear up some myths surrounding liposuction. Hi, Doctor. Nice to see you again.
Hi, nice to see you.
Good. So let's begin. Clear up some myths about liposuction. What are some of the different procedures?
Yeah. So some of the procedures that are associated with liposuction, I mean, there's so many right now that the consumer could really get confused. But one of the greatest advancements in liposuction came about 15 years ago, 20 years ago, and that was something called tumescent liposuction. So before, all liposuction was done just under general anesthesia. Mm-hmm. You had to be totally asleep because it was quite painful, and they would just, remove the fat So it was kind of a bloody procedure, and it was painful. Yeah. But it worked, Yeah. Although if that wasn't the case, people would never do it.
Right.
But it works. So this doctor figured out that if we add, so during a procedure, what is tumescent liposuction? So what we do is we take some normal saline, right, some sterile normal saline, and we mix with that some lidocaine, which is numbing medicine, and a little bit of epinephrine, which is adrenaline. And that little bit of epinephrine constricts all the blood vessels. And the lidocaine numbs all the nerves and numbs everything. So it's quite possible to do this liposuction completely awake and completely bloodless at this point. My personal preference is to do this with a light sedation because it just takes the edge off. And I found that when people are completely awake, they're
tense, right?
It's an uncomfortable procedure. I want to make it as comfortable and comforting as possible. And when done properly, it really reduces the amount of downtime, discomfort, because the lidocaine will last for about 18 hours after the procedure's over. So you're quite comfortable into the next day. And if you look at pain studies, they show that if you can keep someone comfortable immediately after the procedure, their pain and how they recover and how quickly they recover is much advanced. Okay, now when you say recovery time then, is this an outpatient surgery, and how soon can they go home after? Yeah, liposuction is absolutely an outpatient procedure. So people go home. The procedure generally takes anywhere from 30 minutes to an hour and a half, depending on the size. Recovery is anywhere from 1 to 2 days. But I tell my patients 1 to 2 days, 3 days out, I want you to be doing your normal routines. And it's absolutely necessary for them to be doing that. The quicker you get moving, the better you'll feel, the quicker you'll recover. So I just wanted to mention just one other thing about the liposuction. Because there is another technique. I personally like to use laser. There's also vibrational. There's also water jet. There's lots of different sort of takes on how to get that fat out and how to get it out cleanly and essentially bloodless and painlessly. Because there's a lot of associated procedures with using that fat, because we found that there's a lot of stem cells within that fat. So it's paramount that we treat that fat gently.
Okay. So what's the difference between the laser liposuction and the regular liposuction then?
So before, once you put in the numbing medicine and the epinephrine, so everything is sort of constricted and numb, then we take a laser, and it's very small, 1 millimeter in diameter, and you use a laser at a certain wavelength of light, and it basically melts the fat. So it liquefies the fat, or if you use vibrational, that vibrates and liquefies the fat, or if you use hydrodissection, pulses of water sort of loosen the fat and allow you then to suck it out.
Okay, so those are all going into you, whether it's the laser or the
all
water
going
or
in.
anything. Okay.
But then essentially the end point is removing it. All liposuction procedures are invasive in the point where you're removing the fat. But these are through, you know, tiny, tiny fingernail-sized little incisions, no scars, very, very easily tolerated. It's a great procedure. It's one of the top 3 most common procedures in cosmetic surgery.
And they can be done all over the body. I mean, the liposuction can be done on
anywhere,
arms, legs.
anywhere. Yeah.
Okay.
One of the things that I'd like to talk about before we finish is you know, liposuction will do very little if you have a lot of skin. So if you have a lot of skin and a lot of fat, it's not just going to cellophane, like just shrink up once the fat's gone. The skin will still be there. So a lot of times it has to be combined with skin shortening or like tummy tuck abdominoplasty type procedures to remove that fat and skin at the same time.
Which we're going to talk about in a segment coming up soon. Right.
Yes.
Excellent. Well, thank you again for being here, and we'll see you next week.
Thank you.
All right. Thanks, Doctor. Coming up next, we'll talk about peripheral arterial disease, so please stay close. Dr. Sampson returns today to discuss peripheral arterial disease, or PAD. Thank you for coming back today. It's nice to see you.
Thank you.
Could you tell us what PAD is?
So it stands for peripheral arterial disease. So as everybody knows, the body has arteries and veins, and we've discussed veins before. But it's the arteries that really are so much important to your body because they take blood out to supply the tissues. And if you have a problem in the arteries, then your tissues can die. So peripheral arterial disease is where you get a blockage in the artery that supplies mainly the legs, sometimes the arms, but it's mainly the legs. That's why it's called periphery, away from the heart. But it's the same disease process that affects the heart. So someone who has a heart attack, they've got arterial disease of the heart. Someone's got peripheral arterial disease, they've got arterial blockages in the arteries to the legs.
And how is this diagnosed, doctor?
Well, the majority of people have it without even knowing that they have it. But sometimes the doctor will do a pulse examination on your legs and find that your pulse is not good, or you'll complain of a symptom of peripheral arterial disease, which is mainly trouble with walking. So the person they go for a walk, they start to get discomfort in the leg, they stop walking, the pain goes away. And that's because when they're walking and they don't have enough blood supply, acid builds up in the leg, and that causes pain. And when they stop walking, the acid washes out, the pain goes away. There is a medical term for this, it's called claudication, but you're not supposed to know that.
Okay, you're not supposed to know that, or it doesn't, I mean...
Well, we know about it, but you don't have to.
So if, for example, I mean, the average person, they're walking, this happens, is there a numbness, or is there a tingling, is it just a pain? I mean, what is the most common?
As the blockage gets worse, there are going to be more and more symptoms. So usually the walking distance gets shorter and shorter. And then you get pain even at night while you're sleeping, because when you're lying flat, you don't have gravity to help the circulation. So those people say they have to get out of bed to let their feet dangle over the edge of the bed to get rid of the pain. And then as things progress, they can actually get an ulcer of the skin where they get a wound, or even gangrene.
Oh my goodness.
So we as doctors, we do have tests that we can do, and one of the simplest tests is to use a thing called a Doppler. It's like a special little stethoscope that we put on the artery, and we can hear the blood flowing, and based on that we can tell whether you have circulation trouble or not.
And what is the common treatments for PAD?
Well, the majority of people don't need any treatment per se for the blockages. They can live with the blockage. Treatment would be a quality of life decision. So most people can get around adequately. They don't need any treatment. Certainly they need medication to prevent the blockages. So as I've said, this is the same blockage that causes heart attack, same blockage that causes stroke. So a lot of people are put on drugs called statins that change cholesterol, because that's one of the causes of blockages. Some people take aspirin. Some people take a drug called Plavix. people need those medications, but do they really need some invasive treatment for their leg? That really depends on their quality of life. So we tell the patient, if I had a treatment that was painless, cost nothing, and was guaranteed to work, they would have it. We don't have such a treatment. So our job as the vascular surgeon is to explain to the patient what the different treatment options are, and then let them make a decision.
And that's it. I mean, everybody should be informed, and unfortunately, like you've stated in the past, people aren't given all the information that they need.
I think one of the reasons that I'm here again, as I was the last time, is to tell people that they shouldn't be forced into having treatment. This is a quality of life decision. So if the doctor says to you, you're going to lose your leg unless you have this treatment, that may actually be true if you've got gangrene or if you've got a sore that's not healing. But if your only trouble is walking, you're not going to lose your leg unless something terrible happens. So be an educated consumer of information. Know what you're in for.
Now, are all doctors able to diagnose and treat?
Most doctors can diagnose and treat PAD, but there are various treatments. They can be a balloon procedure or a stent, or it can even be a bypass operation. So the only group of doctors that can do all of that are obviously surgeons. So vascular surgeons can give medications, they can treat with balloons and stents, and they can do surgery. But there are other doctors like cardiologists, interventional radiologists that can do balloons and stents. But not everybody should have a balloon or a stent. So we kind of feel you should go to somebody that can offer you all the different treatments.
Now when you say quality of life, so if somebody decides that they don't want to have anything done at all, is it a gradual thing that will just over time?
The majority of people don't get worse. So we tell them to exercise, because the more you exercise, the more you build up what we call collateral arteries that will kind of go around the blockage. And patients can often do very well just in an exercise program.
And it will increase your blood circulation, your blood flow.
Correct.
Okay. Well, again, thank you for all the
Our
information.
pleasure.
I really appreciate it.
Thank you.
Thank you. Tune in next week to hear more from Dr. Sampson. Stay tuned. Aging Gracefully will return right after the break. Here today to talk about an upcoming auction is the owner of Sarasota Estate Auction, Andrew Ford. Hi.
How are you?
Good. Welcome back. It's been a while.
Thank you very much.
Nice to see you again.
Thank you.
I know it's just in time for an auction that you have coming up right around the corner.
February 26th. It's a Sunday this time, 11 a.m. start. It's a fine art sale, antiques, there'll be bronzes, silver, large collection, over 800 lots, so it's a very large auction this time.
Okay, and we've talked about that before. People can go online, call you to find out what you have available.
You can always look first at our website, sarasotaestateauction.com.
Okay.
But you can also come in person anytime a week before preview. 6030 North Lockwood Ridge Road on the corner of University and Lockwood Ridge. And you're warmly invited to come preview the objects. We very much encourage that.
Okay. Now, how often do you hold auctions?
Our auctions are generally every 5 to 6 weeks in season. Essentially, it's the last weekend of every month. However, depending on holidays, sometimes it's a 5th or a 6th weekend from that.
And how can our viewers find you if they would like to consign something with you?
Well, they can always contact us directly at 941-359-8700. They can also leave us an email at sarasotaestateauction@gmail.com. Or they can always come in person and speak to us. We do house calls. We come out to the house and give them general valuations on their objects, and it gives them some idea if they'd be interested in working with us.
All right. And talking about upcoming auctions, now I know you have a two-session auction coming up in March.
Yes.
So there's still time available for people to call you and consign items.
We are still encouraging consigners to bring in marine-related material. It's a nautical sale we're having this year. We're also having a fine art and general sale as one of the sessions. But the main focus and the feature is the nautical sale that we have. So anyone who's interested in nautical items in general, whether it be to purchase or certainly to consign, if you have any wonderful ship's models at home or paintings of clipper ships, early marine paintings. We've got some very important artists that'll be in the collection, and it would be ideal timing for a consignor to bring us any of their nautical type items.
And as we discussed before, whether it's with this particular auction or others, it's an opportunity for people who are downsizing, or they have inherited maybe their family's, art collection or something. Is that type of people you're looking for as well?
Very definitely, absolutely, yeah. If you have an abundance of material at home that you're not using, so to speak, or not exhibiting at the house, it's a perfect reason to come into the auction. But certainly if you've come across something, or a friend or a neighbor or a relative have brought something more important to you, we can really perform well with these objects, especially in these specialty sales where our audience looking at us will be major marine collectors, corporate collections. Last year we put a large boat that was in one of our sales. It went to the Hong Kong Maritime Museum.
Oh, wow.
And it brought a large sum of money. So often timing is everything.
Excellent, excellent. Now, for someone who's never been to an auction before, who might, be thinking about attending, it might be intimidating to that first-time attendee. What could you tell them about what to expect when they walk in? I mean, is somebody going to, grab them by the arm and say, "Come buy something"? I mean, what's it like?
We have greeters and runners that meet you at the front door and just kind of walk you through the experience. Some people like to talk. Some people prefer to, experience it on their own. But certainly, if we have runners that will do bidding for you. Some people are a little shy, and we have runners that will sit with you. And if you're planning on bidding on a certain diamond ring, possibly, or something, and you're not totally comfortable with the process, our runners are there just for that reason to help you.
Okay, so otherwise, now if you don't have a runner, if you go in, I mean, do they have, I've seen paddles in places?
Come and register. You come and register. That allows you to have a bidder paddle. We ask nothing from you except your information so that we can contact you as far as payment is concerned. But you'll have a bidder's paddle, and there are typically 50 to 60 of us at the auction. We cater the auction through Tsunami Sushi, so if you like to have lunch on us, come on out and a glass of wine. It's a very comfortable setting.
Very nice, very nice. Sounds like a delightful way to spend an afternoon and shop.
It is indeed.
And I know that you're going to be giving our viewers a couple other opportunities, because you have some downtown stores already in place? Or?
We're located at 522 South Pineapple Avenue. That's our downtown gallery.
Oh, okay.
You can always come in. Our hours are wide, or 10 o'clock in the morning till 9 o'clock at night, Monday through Saturday. Located in the Burns Court area, next to Fish Camp Restaurant and the movie theater downtown, so it's very easy to find us. And often people come in the evening and we'll chat a little bit about some future events. We often have exhibitions at the gallery, but it's a large collection of antiques all the way through mid-century modern.
Okay, and how long have you actually been in business, Andrew?
I've been in Sarasota actively as a gallery owner for 23 years now. I was on St. Armand Circle for some time, been on Pineapple and Palm, within 6 blocks of the downtown area for the past 20 years.
Yeah. And that's important for people to know too, not just to give their artwork just to anybody, but go to somebody that they can count on and trust.
We've been doing this a long time. This is all I've ever done since I graduated college. So we're very familiar with the art business, and being a gallery owner, we're very familiar with relative pricing, fair market valuations. So having been a dealer and doing large trade shows, important trade shows over the years, I have a keen idea of real market values on these objects.
Great. Well, thank you. It was
Thank
nice
you very
seeing you
much.
again,
Absolutely.
and good luck with your auction.
Thank you. Look forward to seeing you again.
That's all for this week's episode. Please tune in next Saturday and Sunday for more of Aging Gracefully on Suncoast FYI.